Hi there, nurse practitioners. Fiona here, your go-to guide for making charting easier. And today, I'm introducing you to a tool that's transformed how I practice, DocScrib. This smart AI-powered assistant listens during your patient visits and automatically captures the critical details of your conversation, whether it's you or the patient speaking. Then it organizes that into a professional, complete chart note. I've personally started using DocScrib in my clinic, and honestly, the results have been outstanding. Here's the exciting part. DocScrib understands clinical language, ensures proper medical terminology, and delivers clean, error-free documentation. It's precise, fast, and seriously reduces your time spent typing. When you create your DocScrib account, you'll get a few trial sessions to test things out. No strings attached. And when you're ready to commit, make sure to apply my code NPSHarding to get $50 off your first month. The standard monthly fee is $99, and in my opinion, it's well worth it for the hours you'll save. Let me walk you through what happens once you're logged in. The dashboard is intuitive and lets you dive straight in. For example, I ran a mock session where I played both the provider and the patient coming in with chest pain. I activated DocScrib, and it automatically summarized our interaction, from symptoms to denials, into a clean, focused HPI, history of present illness. I even clicked Make Concise to trim it down to just the essentials. Next, you can dictate or speak out loud the physical exam or objective findings, either in real time during the visit or right afterward if you prefer not to speak in front of the patient. DocScrib transcribes everything and builds out the note for you, including the exam findings and assessment. The system goes a step further by generating a plan based on what you say, or even what you don't say. In my example, I just mentioned labs in general, and DocScrib intelligently suggested appropriate ones like CBC, BMP, cardiac enzymes, and even flagged an EKG, without me spelling anything out. That's how well it understands common workflows. It also includes tailored patient instructions based on the diagnosis and conversation. You can easily copy or print these for handouts or your EHR. After each encounter, you can make quick edits, tweak wording, adjust pronouns, add context, and then save and copy everything into your electronic record. I have personal templates for my EHR, and pasting from DocScrib is seamless. The best part? You don't need to ask your clinic or IT team for anything. There's no waiting for integration or admin approvals. Just sign up and start using it on your own, instantly. Now let's take a quick demo. I'll pretend to be both clinician and patient to show how well DocScrib captures a visit. Hi, welcome. You're here for a sore throat? Is it painful to swallow? Yes, it hurts. When did it begin? Yesterday. Fever? Yes, 101 degrees. Runny nose, cough, ear pain? No to all. Taken anything for it? Tylenol. So, from that brief exchange, DocScrib builds the subjective section. You can also speak your exam out loud or add it later. For example, we'll test for strep, and if positive, start antibiotics. Recommend Tylenol or ibuprofen, rest, fluids, and return if symptoms worsen. You can optionally tag the patient using initials or a code. DocScrib is HIPAA-compliant and only stores what you enter. No auto-saved personal info. Notes are usually ready within a minute or two, which is perfect while you're ordering labs or e-prescribing. By the time you're done, the chart is too. Hi there, nurse practitioners. Fiona here, your go-to guide for making charting easier. And today, I'm introducing you to a tool that's transformed how I practice, DocScrib. From chief complaint to differential to plan, DocScrib simplifies everything, even suggesting diagnoses and follow-ups based on typical medical reasoning. You can view a full transcript, generate patient summaries, and save or print the outputs. Ultimately, it frees you to do what matters most. Actually talk to your patient. You're not distracted by typing or clicking. You stay engaged, and DocScrib handles the notes in the background. So, if you're ready to reclaim your time and streamline your charting, give DocScrib a try. Use my link below and the coupon NPCHarding to save $50 on your first month. You'll also get a few trial visits to explore how it fits into your workflow. Let me know if you have any questions, and happy charting with DocScrib.